I'm Kirsten Corazzini. I'm an associate professor at the Duke University School of Nursing and a senior fellow in the Center for Aging and Human Development at Duke. My current appointment here is as a Fulbright Schuman scholar. I am here to contribute to advancing our understanding of how to provide high-quality, long-term care to older adults in a person-centered way that better integrates registered nurse clinical expertise on how care happens on the front lines of long-term care.
So you've been there for about a week at the Sahlgrenska Academy. What are your impressions so far?
Innovation, warmth, and welcoming. I've been already had several stimulating and interesting conversations with both doctoral students and faculty here about the landscape of long-term care and a real commitment to advance innovative models of care in a way that really honors the personhood of older adults, which is really, I think, a critical and important contribution that the researchers here at the university under Inger Ekman's leadership have been able to advance in gerontological care.
In your project, you're going to compare Sweden with Britain when it comes to person-centered care. Why is that an interesting comparison?
Well, so one of the unusual features of my fellowship here is that I will be conducting comparative policy research of long-term care and comparing how nursing care of older adults in the UK and Sweden and the US compare to one another in a way that could actually inform both EU policy as well as inform US policy. So if you think about it, the US, the UK, and Sweden really fall along a continuum in terms of the public resource investment in nursing home care and community-based care options for older adults. Yet, despite very different kind of resource allocation choices, all three of our countries face very similar challenges in terms of the recruitment and retention of highly qualified registered nurse to care for older adults, aging populations, and essentially what will likely be very limited or no new resources in long-term care. And yet, we must devise models of care that preserve personhood and and high quality of life for older adults and their family members.
So how will you conduct this project? How will you start?
My approach will be to essentially split time here with Dr. Inger Ekman's group at Gothenburg and time with another senior nurse scientist, Julienne Meyer at City University London. And I will be spending time talking with nurses in nursing homes, as well as hopefully having the opportunity to interact with some nursing home residents and other supportive staff to better understand how their facilitators and barriers to implementing person-centered care.
You are an associate professor at the Duke University School of Nursing in North Carolina. How far would you say that the implementation of person-centered care has gotten in the U.S.?
Great question. So person-centered care is part of a larger movement related to culture change in nursing homes in the U.S. This really has been identified as a federal level priority in improving care. However, there's considerable variability in implementation. By contrast, Sweden has really made significant advances in both how we think about person-centered care, that is, supporting the personhood of older adults and their families, as well as the measurement, even insofar as relating person-centered care to better outcomes and improved costs of care.
Good luck with your project.
Thank you so much.